This time of the year brings about more opportunities for socialising, festivals, parties.
We've had lots of children really unwell in ICUs.
There's very little research to say that the just say no approach works.
Hello and welcome to the RCHT podcast. With the summer holidays approaching and events like Boardmasters just around the corner, we're talking about drugs, alcohol and how we can help keep young people safe. I'm joined in the studio by Chantelle Hellier, who's the safeguarding practitioner for children at Royal Cornwall Hospital's NHS Trust, and Jodie Lynes, who's YZUP team leader at WithYou. Welcome, both of you, to the studio.
Thank you.
Do you just want to tell us a bit about your roles? Because you worked together recently as well, didn't you?
Yes. So I came from YZUP about 9 months ago. So I worked with Jodie. Then I came over to the safeguarding children's team for RCHT and CFT.
Brilliant. And tell us about where you work.
Yeah, so I work for the organisation that's known as WithYou. So that's a national charity supporting people with difficulties with drugs, alcohol and mental health. And specifically here in Cornwall, we have a young person's service that's known as YZUP. And I'm a team leader in that team.
Awesome. So with the summer holidays approaching and we've got events like Boardmasters on the horizon, why do you feel like now is an important time to have this conversation about drugs and alcohol?
I think really it's the fact that the summer holidays this time of the year brings about more opportunities for socialising, festivals, parties, social gatherings. And during that period and sort of for some young people, maybe they finish school, their kind of social opportunities increase. And potentially alongside that for some, so do the kind of risks that could be associated with decision making around drug and alcohol use.
And from your experience working with young people, what are you seeing at the moment when it comes to drugs and alcohol in Cornwall?
So I would say really kind of, we're thinking about what we kind of really want to focus on, what we want to talk about is alcohol use. That is common for some young people. And in addition, kind of within our student sort of populations as well, is the use of ketamine as well.
And Chantelle, are you seeing different things coming to the hospital or is it the same kind of thing?
Similar really, but all sorts of stuff really. We've had, some occasions where spices come in, more so ketamine at the moment, lots of alcohol and drug overdoses. And that can be, especially with what you're talking about with the summer, there's risks of summer because they're not seen in school. People are left, there's no structure or routine. And then also children, from my perspective, that are in homes that are not so safe, also use that as a coping mechanism. And when there's no school and stuff, that can increase, and for the hospital as well.
So you both mentioned ketamine there. Can you tell us about what that is and what signs you might see from that?
Yeah, so the ketamine is a drug that we've seen sort of steadily increase in availability to young people. That's part of the kind of difficulty with it. It's quite readily available. It's also quite cheap. And some of the kind of effects of ketamine might be that people report feeling quite euphoric, that kind of lights and sounds can kind of be exaggerated, which can be quite a pleasant experience. But equally, we've seen people struggling with psychological dependence, increased tolerance of using ketamine. And because of the fact that it is quite cheap and dosages can kind of last between 40 minutes and an hour, we see people wanting to redose to get those effects back again.
Right.
And actually that can have quite a significant impact on physical health, including kind of the worst case scenario is significant damage to the bladder, which sort of the end product of that over a period of time of using and frequency and amount of use can mean that the bladder does have to actually be removed. And so I think one of the bits that we're kind of trying to work on from a WithYou kind of organisational perspective is encouraging education around ketamine, and so that people are aware of some of the risks that are associated with using it.
And how might people who are kind of seeing a patient come in who's taking ketamine, what sort of signs might they see when they enter the hospital?
Again, it's just being, unwell. It's bladder and bowel issues. Currently, from our children's safeguarding team, we're working on doing some training actually with YZUP and delivering that to staff who might want that, to look out for the signs in that professional curiosity around ketamine use and the damage that actually does do. We've had lots of children really unwell in ICUs and stuff here in the hospital because of ketamine use. And again, not just ketamine use, but then mixing that with other substances, and to look out for that in particular. So we're doing a piece of work around that at the moment to raise awareness around it.
Fantastic. And lots of young people will be going to festivals and parties and social events over the summer. What things would you most like them to be aware of?
I think it's about being aware that there is a potential that they may well be opportunities to access things like drugs and alcohol. And so it's kind of being prepared for that and being prepared of how you're going to kind of make those decisions and navigate those kind of situations that might arise. It's also about if people are going to go to those sort of events and choose to use drugs and alcohol, it's making sure that they've got a good level of education and information about what certain substances are and what they do. In addition, kind of that thing about looking out for each other within groups of friends and making sure that, you know, people kind of can buddy up when they're kind of, if they choose to use drugs or alcohol, so that there is maybe a sober friend that can help look after somebody, or if a group of friends are using substances, they could like kind of incorporate a sort of buddy system where one person uses the substances, the other one waits. Then when that person kind of the effects have worn off, the other young person takes them. So there's lots of different ways in which young people can kind of consider ways to reduce the potential harm that drugs or alcohol could cause at those events.
Yeah, and I don't know if you saw it in the news, I think it was last week, where there was an 18-year-old girl who went away to Magaluf, and she was just going to the toilet, and when she came back from the toilet, somebody bumped into her and jabbed her with a needle. And she said she literally had 20 seconds to be able to find her friends and have them keep her safe, which was quite scary, really, isn't it? And her advice really was to stay with your friends and don't go out by yourself. Is that the sort of advice you would give as well?
Yeah, definitely, I think, and being aware that, you know, at places like Boardmasters there is the medical welfare tent, so that's always around. And yeah, just staying with people, not mixing things if possible. And I think with young people as well, which you might agree with, Jodie, is that pressure of feeling like they don't want to tell people, that people will judge that. But I think in terms of being like in the hospital, people would rather that they call for help 999 and get that help, and no one's going to judge them. But that's really key because it's such a short time frame with overdose and drugs and stuff. So getting that in straight away and calling for help or getting medical attention if needed is definitely the safest thing you can do.
And for parents and carers or professionals who work with young people, what are some of the signs that might make them concerned about a young person's drug or alcohol use?
This is where it can get tricky, because when we're looking at young people, we're also looking at adolescent development and actually some of our teenage years and those sort of things can display changes of behaviour. But actually that is what we're looking at. We're looking at significant changes to behaviour, changes in friendship groups, mood swings, again, you know, outside of the ordinary kind of adolescent mood swings that we're aware of. Thinking about kind of their presentation, how well they're looking after themselves, but any real significant changes that can occur, sometimes can occur quite quickly. And so it's about kind of people being aware of them. And sometimes that can be for a group of people, not just parents. It could be extended family members, just being open and honest with each other about kind of things that you might be noticing regarding your child or children. Yeah.
Yeah. And those conversations can be quite difficult to have sometimes, can't they? If someone's worried about a young person, how would you suggest they start that conversation?
I think it's about not being judgmental and not accusing, just checking out with them really, like how's things going, staying calm, not judging. I mean, it's difficult just to say to someone like don't use drugs and alcohol, because if they're in that, it's really difficult. But just having that non-judgmental space where they feel safe enough to open up about it and get help, because if someone's going to accuse them about something, they're going to just shut down and withdraw, and that can like increase the risk. So I think from my perspective, that would be what I would advise. Yeah,
and I think there's very little research to say that the just say no approach works. It actually doesn't. There isn't any evidence to tell us that it does. And so actually encouraging really open informative conversations is really, really important. And we talk about sort of green light moments. So when you're calm as the parent, carer or family member, when the young person is calm, I often make reference to the car journey, that sitting side by side rather than facing each other can be a really good time. And I think curiosity, I think that's something I really strongly kind of advocate for, is being curious as a parent or carer. So even if you're not thinking that you've got real concerns about your own child, the likelihood is they may have some information, knowledge. It may be some other friends are using drugs or alcohol. So showing that curiosity and interest. And actually a lot of young people like it when you give them the kind of open space to have those conversations. So you might say to them, do your friends talk about drugs and alcohol? You know, they're just really gentle ways to open up that conversation, which longer term, that means they're probably more likely to come back to you and talk about it if they are concerned about something. Yeah,
you mentioned just say no, but are there some common mistakes that people make when they're starting to have that conversation about drug and alcohol use with young people that might kind of put them off the conversation maybe?
I think, like Chantelle's talking about, it's that judgment. It's that, and as hard as, I'm not sitting here saying that is simple, but as hard as that sounds, it's really being clear with yourself that you're going to come from a perspective that's not judgmental.
Yeah.
And that can be difficult as a parent as well, being worried about your child. It's like that initial reaction of like they don't want them to use drugs and alcohol, but it's far more complex than that. So I think what you said, Jodie, about having that safe space as well will do more, likely to do, have better results almost than cause more harm, just having that safe space.
Showing concern. I think I'm a bit concerned, actually, coming from a sort
it's
of...
language.
the language that's used.
Yeah, absolutely. And we know that young people can often find themselves in situations where drug and alcohol are present. What advice would you give them about keeping themselves and their friends safe?
I think if we go back to kind of talking about specific events like festivals or parties, it's almost like before you even embark on that adventure that you're taking, it's kind of having that idea of where are the kind of welfare people, where are security, where are, if it's a party or a beach party, where is there access to a phone signal? All those kind of really good preparation kind of tips are really important so that it's the same with sort of, I always kind of make the comparison to crossing the road, or if we go to the beach, we might swim between the red and yellow flags, or crossing the road, we might look for a crossing. It's that whole continuous risk assessing, which for some young people can sound terribly boring, but it is about that bit about having those conversations to be prepared for those things.
Yeah, definitely. And I think as well, a lot of kids we see or adolescents that we see at the hospital, they're actually, if you ask them, they're actually terrified in that moment. So although at the start it might seem like boring for them to know that, but when they're left in that situation and they're feeling like a bit unwell and everyone's left around them, it's having that safety plan that will make them feel safe, because there's been situations where that hasn't happened and they're terribly scared and unsafe and they don't know who's going to help, or they can't even use their phone because they're under the influence of drugs and alcohol, and that's not nice for them to experience.
Sorry, just to add, the bit to add really is that if somebody is going to choose to use drugs and alcohol, it's the importance of not mixing substances. I think you touched on that, Chantelle, but in particular, even alcohol, that's classed as a substance.
Yeah.
So not using a drug and alcohol together, because actually the effects can increase risk significantly. So being really clear on what intentions are, what expectations are. We don't know what is in any drug. There's kind of, there's lots of risk associated with that. But what you can do is kind of prepare for that by not mixing, using a small amount, timing out between dosages of using substances, so that there's been a space between using and when you next use. But there's lots of really kind of good harm reduction advice that's easily accessible out there, and obviously we're talking about now, but just can kind of add to that preparation to reduce risk.
And I think, like you said as well, when you're at events like this, there's a risk that maybe your phone doesn't work because the signal's not good, or perhaps you lose your phone or something like that, and maybe having somewhere pre-arranged that you could meet just in case something does happen, or you can find each other after a certain amount of time as well might be useful to do.
Really good idea, yeah.
And if someone's worried that a young person has become unwell because of drugs and alcohol, what are the warning signs that we really shouldn't ignore?
I think mainly around, Jodie, you can probably add to this, but like any sort of seizures, noticing your heart's changing in any way, sweating, clammy, feeling or being sick, passing out, behaviour changes. So maybe about, if someone's acting completely differently.
Yeah, I think it's just that it's the noticing that, and that's the bit where it comes to that buddy system or your group of friends and sussing out who the kind of safe person is in that group to monitor those things, because friends do know each other quite well and they'll be able to notice if there is a sudden change. But absolutely, all those physical things that Chantelle's just talked about is really important to sort of notice and be prepared to add sort of. I think it is that bit that you mentioned about not being afraid to act. So actually getting somebody in a shady area, ensuring they're given water to sipping water, not drinking lots of water. Mm-hmm. If they are looking like they're becoming even more unwell, is getting them on the floor. Best thing is a recovery position, but if not, on their side.
Right.
So it's that idea that things can change quite dramatically when drugs and alcohol are kind of being consumed, and I think it's really important that people aren't afraid to kind of go to the extreme just in case, because you can't go wrong that way, really.
Yeah, and definitely just if you're unsure, I always think just ring for help.
Yeah.
Because no one's going to judge for that. I think that's the safest thing you can do if you're unsure, rather than leave and see how you are.
Absolutely.
Later, definitely ring for medical help. And
for someone listening who might be worried about themselves, a friend or maybe a family member, what support is available locally through like YZUP and WithYou?
WithYou. So all of our support you can find on the WithYou website. That also has links to our specific young person service as well. There's an online chat that's really great. People can just reach out and kind of say they're concerned about somebody, a loved one, or themselves, and they will be instantly connected to a chat advisor that will give them kind of ideas of who they can call more locally if they need to. And just to be aware that sort of in particular, because that's my service, but the young person service, we are in schools. We deliver workshops around drug and alcohol education in secondary schools, colleges. WithYou nationally also does lots of schools workshops, residential care home settings. So there's lots of information out there. And equally, the WithYou website has got a directory of different substances and links to things like the Safe for Cornwall website, where there's more information on lots of different substances and ways to kind of try and stay safe and reduce harm.
And Chantelle, what NHS facilities are available to support you if you're medically unwell?
There is obviously your GP, but then in terms of like those emergency situations, it depends on how that is. But there's 999 if you're unwell. If you're like at Boardmasters, for example, what you were talking about, 999 would be the best option. But there's the MIUs that are around. We've got an emergency department here, which is 24 hours where you can just come in at any time. And
are we going to have an NHS presence at Boardmasters as well?
I'm not sure on having there. I think there is support there. There's some chaperones, isn't there? I think Jodie, in terms of working at Boardmasters. So they're like they work in the welfare tent.
Yeah.
And then it'd be a case of them triaging that and calling for help if they need to go to hospital, whether they can manage it solely at the festival.
And finally, if there's one thing you'd like young people, parents and professionals to take away from this conversation before the summer holidays, what would it be?
Oh, I think really it's like listening to that gut intuition and always call for help, because there's so many services and so many professionals that want to help. And I think there's that, judgment of like, I can't do that if it's around drugs and alcohol or I might get in trouble. But I think there's so much support out there. So it's reaching out for that support, because even that one door can open many others and that can massively change your life on a path that you're going down, and get the support, because everyone deserves support and that is available. So reaching out and getting some help for it.
How about you, Jodie?
I think I'd just add to don't be afraid to have the conversation. Let's talk about it. We know that drugs and alcohol are readily available to young people, older people, and therefore just talking about it I think some people are worried that if they have that conversation, they're opening a door or opening a can of worms. But actually, by opening that kind of door, we're kind of engaging in conversation, and we can instantly start thinking about ways in which we can support people to consider the risk and work at ways to reduce the risk as well. So it's being confident in having these conversations. That's what I would say, yeah.
Chantelle and Jodie, it's been great to talk to you in the studio today, and there's been some great advice as well. Thank you so much for your time.
Thank you.
That's it for this podcast. Thank you so much for listening.
If there's an improvement or achievement within your team you'd like to talk about, or a story you'd like to share, please contact us on rcht.communication@nhs.net, as we'd love to hear from you.
And don't forget to subscribe so you can be notified of future episodes.
We are RCHT.